enlargement and is homogeneous, heterogeneous. Okay, so now if this is the testis, usually there is a small mass. When there is a small mass, that it does not cause effect on the testis because testis is not enlarged. So it would be heterogeneous. Heterogeneous. Now teratoma. Teratoma is a germ cells tumor. Teratoma is a germ cells tumor. What is germ cells means? It comes either from ectoderm, mesoderm or endoderm or combination or mix. This teratoma, there's a types. So dermoid type, cystic dermoid, solid dermoid. And this teratoma, usually it is very common in infants and children. But adult version, if it is found in the adult, is always malignant. Okay? So you can say mostly it is a mixed cells tumor, germ cells tumor, and some young age adult version is always malignant. Adult version is always malignant, and it is associated with alpha fetoprotein and beta HCG elevated alpha fetoprotein and HCG are elevated. Okay, so these are the cancer varieties, and it is a well-defined solid mass. You can write down well-defined solid mass, and heterogeneous definitely contains calcification. It is heterogeneous. It looks heterogeneous with calcification. Okay, just remember these 4 types of malignant in cell, then you will be fine. And now I will go over the prostate gland. Okay. One thing that is called testicular calcifications, called microlith, or you might get one picture like that, testicular granulosa. I'm gonna give you that diagram. Testicular microlithiasis. Lith means stone. So it happens due to gramatonolos. That means, let me give you. See, I forgot the name of the term. Granulomatosis, yes. Mitosis due to bacteria fungus, those who are immunocompromised. Okay, bacteria, fungus, what are the bacteria? You'll see the tuberculosis, testicles can have tuberculosis, and fungus. So in sono images, if you see this is the testis, then you will see the microlith, means calcium deposition all over the testis. A patient is suffering from HIV, or patient has splenectomy, and you scan the testicles, you found a lot of hyperechoic spots all over the testis, both testes. That is microlithiasis. This microlithiasis causes infertility. Okay, so this is microlithiasis, this blue one. Microlith. Okay, now Okay, understand this diagram first. Okay, this is bladder, this is prostate gland, and this is urethra, this is scrotum, and this is seminal vesicle, and this is vas deferens. Just understand that from the tail of the epididymis, this vas deferens is going through the inguinal canal, and then it's going by the side of the, I'm just making it little to show you. Okay. Did you notice the loop? Look. Nice. So now it is the loop of the vas deferens. Look at how long the vas deferens is. At this area, it is passing through the inguinal canal. Then it loops by the side of the bladder. Then it enters into the prostate gland. Then it joins with the vesical duct. From here to there is ejaculatory duct. And this ejaculatory duct enters into the urethra. That entering area is known as verumontanum. It looks like it's a name of a mountain. It's a triangular shaped area where the two ejaculatory duct unites with urethra. That is called verumontanum. Sonographically, can we see? Yes, we can see that. So now, look at the functions of the prostate gland and its relationship. Prostate gland is a chestnut shaped. It is inferior to the bladder. So this is the neck of the bladder. And this is the base of the prostate gland. Base. So base of the prostate gland is with the neck of the bladder. So prostate gland is inferior to the bladder and bladder is superior, and seminal vesicles are entering into the duct, is entering into the prostate through its behind. So this seminal vesicle are posterior superior, or you can say posterolateral. Posterolateral. How many? Two. They are bow tie shaped, right? Seminal vesicles. Look at the role of the prostate gland. It is a fibromuscular glandular organ. Fibrous part, muscular part, and glandular part. It has a muscle tissue and it has a gland. Gland produces the prostatic juice that directly opens into the urethra by its microscopic duct, and that glandular part also causes the malignancy, prostatic carcinoma, and the muscular part in the prostate gland that causes spasm. Man feels spasm during ejaculation. Muscle contracts, and that muscle contracts tightly, making it a ball, solid ball, and that can compress the urethra. That's why there's a medicine. It makes the muscle relaxed so that man can pee normally. Okay, and it has a fibrous structure because the framework needs a fibrous connective tissue. The anterior part, that means anterior, when the urethra is passing through the mid, if you look at the coronal view, there's the anterior and the posterior. The anterior part is mostly, it is glandular part. Okay, let me see. Let me correct it. Okay. I wrote down here. Okay. Oh, it's in here. Right. Yes. Yeah. Anterior part is a fibromuscular stroma, non-glandular. So anterior part is non-glandular, and peripheral part, we call it posterolateral part, is a more glandular part. Okay. So now I'm going to draw another diagram. Okay, so this is the prostate gland, it's coronal view. You need to know this diagram. So this is urethra. So this is peripheral zone, PZ. Peripheral zone is 70% of the gland. This is central zone. Central zone is 25% of the gland. So now 95% gone, right? And transitional zone, TZ. Transitional zone, okay, let me draw it a little better. Transitional zone is 5%. And there is 1%, this is periurethral. Periurethral zone, maybe 1%. So total is 100%. Okay. So this is a prostate gland, looks like a chestnut. It has a peripheral zone 70%, central zone 25%, transitional zone 5%, periurethral zone 1%, and there is an anterior zone. I cannot show it here. Anterior zone is a non-glandular part. Okay? But this is within the central zone. That is in the central zone. So now, 75% malignancy, 75% cancer happens in peripheral zone. And say 20% benign prostatic hyperplasia can happen. But in transitional zone, so 70% BPH, benign prostatic hyperplasia, that happens in transitional zone. Yeah, it is the common site of BPH, and 20% cancer can happen in transitional zone. The central zone, it is anterior to the transitional zone, surrounds the ejaculatory duct. Look at here. Ejaculatory duct passing through the which zone? Central zone. And you see, in between the central zone and the peripheral zone, so this is called surgical capsule. Now give me the idea. Transitional zone is the most close to the urethra, right? And the BPH, benign prostatic hyperplasia, that happens onto the transitional zone. So then what happens? If it happens, what is the problem? The problem is it will push and compress the urethra. You got it? Mm-hmm. So then how a man will pee out? They can. And it's not going to happen in overnight. Usually 50, 60 years, 90% man having somehow prostatic problem. Okay? So now, if it happens, so then you will see the complete urinary retention. So this is BPH. So now they can do the lot of good treatment right now. Before, they used to take the whole prostate out, and 50%, more than 50% people die because of the bleeding. Nowadays there is no bleeding. You can, even though they can do the laser surgery, they can do the transurethral resection of the prostate. They can put the microchips inside. They can give the stent. They lift up the median lobe of the prostate gland, and the obstruction to the urethra is gone. So now understand, if this BPH is too big and it compresses the ejaculatory duct, so then what's going to happen? This patient may complain of pain during ejaculation. Okay? They don't feel comfortness. Now, there might be a malignancy in the peripheral zone. This malignancy will extend slowly. Most of the time, the cancer in the prostate gland can kill a patient maybe by 15 to 20 years. And by that time, his age will be 85, 90. And they say, I don't need the surgery. Okay? They can keep, it's a very slow progressing. It can metastasize to the bone or to the other organs. Okay? So, transitional, the peripheral zone is glandular zone, and it may develop malignancy. That's why during the ultrasonography, transrectal ultrasonography, we need to understand that which zone is peripheral zone, central zone, and transitional zone. So if I draw the diagram, sono image, transducer is here. This is transducer, and close to the transducer, this layer is the rectum, because the prostate gland is embedded on the anterior wall of the rectum. So when the examiner insert the finger through the rectum, they palpate the anterior wall of the